Diyos ug sa tanang kabuhatan. So today, this is the report, the video report for Group 4. So our topic for this video presentation was all about STD and the different components of STD. So here in our video presentation, we have four different topics, which is all about bacterial STD. The second topic was all about viral STD. The third topic was all about parasitic STD. And the fourth topic was all about fungal STD. So under the topic 1, we mentioned here in our video presentation the Chlamydia, Gonorrhea, Syphilis, Mycoplasma, and Bacterial Vaginosis. So under the topic 2, we mentioned the HIV, the Herpes Simplex virus, the human Papillomavirus, and the Hepatitis B, and also the Molluscum. So for the parasitic STD, which is the topic 3, under the topic 3, we mentioned here the Trichomoniasis, the pubic lice, and the scabies. So for our fourth topic, we mentioned the Candidiasis. So maybe all of you wondering what is STD. So STD, also known as the sexual transmitted infection or disease. So STD is only spread through sexual contact. So it can be bacteria, it can be virus, it can be parasites, and it only spread through sexual contact. So the different components of STD will be mentioned by my teammate. So that's all for the STD.
What is chlamydia? Chlamydia is a common sexually transmitted infection that can occur in both men and women. It is caused by a bacteria called Chlamydia trachomatis. The bacteria usually spreads through sex or contact with infected genital fluids such as semen or vaginal fluid. You can get chlamydia through unprotected vaginal, anal, and oral sex, sharing sex toys that are not washed or covered with a new condom each time they're used. Many people with chlamydia have no symptoms or only mild symptoms. If symptoms occur, they may not appear until up to 3 weeks after having sex with someone who has chlamydia. Let's talk about symptoms of chlamydia in men. Penile discharge. This refers to an unusual discharge from the penis which can be clear, white, yellow, or green. Burning or painful during urination. This is a common symptom of chlamydia, and it can also be a sign of other sexually transmitted infections. Testicular swelling. This is less common, but it can occur in some cases of chlamydia. Now let's hop on to the symptoms of chlamydia in women. First, we have vaginal discharge. This refers to an unusual discharge from the vagina, which can be clear, white, yellow, or green. Burning or painful urination. This is a common symptom of chlamydia in women. Now let's talk about the treatment for chlamydia. We have azithromycin and doxycycline. These antibiotics belongs to a class called macrolides. It works by preventing the bacteria from producing proteins necessary for the survival and reproduction. Both are usually given as a single dose or a short course of treatment. They are generally well tolerated, but side effects occur such as nausea, vomiting, diarrhea, and stomach upset. Prevention for chlamydia. First, consistent and correct use of condoms when having vaginal and anal sex is the only way to prevent chlamydial infection. If you are pregnant, getting tested for chlamydia and receiving prompt treatment if you test positive can prevent transmission to the baby. Now let's go to the next sexually transmitted disease. We have gonorrhea. It comes from a bacteria called Neisseria gonorrhea. Sexually active people of any age can get gonorrhea and give it to their partners. Here are the main causes of gonorrhea. Unprotected sexual contact. Having a sexual intercourse without using a condom significantly increases the risk of contracting gonorrhea. Multiple sexual partners. The more sexual partners a person has, the higher the risk of being exposed to gonorrhea. Having a partner with gonorrhea. If one partner has gonorrhea, the other partner is at high risk of contracting it. Anal sex. Gonorrhea can be transmitted through anal sex, even if a condom is used for vaginal sex. Oral sex. Gonorrhea can be transmitted through oral sex, even if a condom is used for vaginal or anal sex. Sharing sex toys. Sharing sex toys without properly cleaning them can spread gonorrhea. Gonorrhea symptoms can vary depending on the location of the infection, and some people might not experience any symptoms at all. Here are some common symptoms of gonorrhea. In men, discharge from the penis. This can be white, yellow, or green in color and may have a full odor. Painful urination. This is a common symptom of gonorrhea, and it can also be a sign of other STIs. Pain or swelling in the testicles. This is less common, but it can occur in some cases of gonorrhea. In women, discharge from the vagina. This can be white, yellow, or green in color and may have a full odor. Painful urination. This is a common symptom of gonorrhea, and it can also be a sign of other STIs. Pain during sex. This is another common symptom of gonorrhea. And bleeding between periods. This is less common, but it can occur in some cases of gonorrhea. Here are some typical treatment options for gonorrhea. Antibiotics. Ceftriaxone. This is a single-dose injection that is often used to treat gonorrhea. Azithromycin. This is an oral antibiotic that is usually taken as a single dose. Other option, depending on the specific situation, your doctor may prescribe other antibiotics such as doxycycline or gemifloxacin. Preventing gonorrhea is crucial to protect your sexual health and well-being. Here are some effective ways to reduce your risk of contracting this sexually transmitted infection. First, consistent condom use. Barrier protection. Condoms are the most effective way to prevent the transmission of gonorrhea during sexual activity. They act as a barrier between your genitals and your partners, preventing the exchange of fluids that can carry the bacteria. Regular testing. Early detection. Even if you don't experience any symptoms, it's important to get tested for gonorrhea regularly, especially if you are sexually active. This allows for early detection and treatment, preventing complications and further spread. Limiting sexual partners. Reduced exposure. The more sexual partners you have, the higher your risk of exposure to gonorrhea. Limiting your number of partners decreases your chance of encountering someone who is infected. Pelvic inflammatory disease. Pelvic inflammatory disease is an infection of the reproductive organs in women, typically the uterus, fallopian tubes, and ovaries. It is usually caused by sexually transmitted infections such as chlamydia and gonorrhea. Causes of pelvic inflammatory disease. Sexually transmitted infection. The most common cause of PID is the spread of bacteria from STIs like chlamydia and gonorrhea. These bacteria can travel from the cervix or the opening to the uterus up into the fallopian tubes and other reproductive organs. Other bacteria. Sometimes, other bacteria, such as those found in the vagina, can cause PID, especially if there is a disruption in the natural balance of vaginal bacteria. Procedures. In rare cases, PID can occur after certain medical procedures, such as a D&C, or a dilation and curettage, or an abortion. PID symptoms can vary widely from person to person, and some women may not experience any symptoms at all. Common symptoms include lower abdominal pain. This is often the most prominent symptom and may be severe. Pain during sex. This is another common symptom. Abnormal vaginal discharge. This may be unusual in color, odor, or amount. Fever. This is a sign of infection. Bleeding between periods. This is also a sign of infection. Painful urination. This may indicate an infection of the bladder or urethra. Nausea and vomiting. These symptoms can occur if the infection is severe. For treatment, we have antibiotics, pain management, and hospitalization. Antibiotics are the primary treatment for PID. Your doctor will prescribe a course of antibiotics, usually taken orally or intravenously, depending on the severity of the infection. Pain management. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help manage pain. Hospitalization. In severe cases, hospitalization may be necessary to administer intravenous antibiotics and provide supportive care. Prevention. Safe sex practices. It is the most important way to prevent PID. Regular STI testing. Getting tested for STI regularly, especially if you are sexually active, is crucial for early detection and treatment. Vaccination. The HPV vaccine can help prevent cervical cancer, which can increase the risk of PID. Prompt treatment of STIs. If you are diagnosed with an STI, it is important to get treated promptly to prevent the spread of infection and the development of PID.
So let's talk about Mycoplasma genitalium. So Mycoplasma genitalium is a bacterial STD like Chlamydia, Gonorrhea, and Syphilis. So, so what is Mycoplasma genitalium? Mycoplasma genitalium is also known as MG or MGen. It's a sexually transmitted bacterium that infects the urinary and genital tracts or the rectum. So, Mycoplasma genitalium is a less known but increasingly common bacterial STD. So, what causes it? It spreads through sexual contact, like having sex, or any kind of sexual contact. Similar to other bacteria, STDs like Chlamydia and Gonorrhea. So, what are the symptoms of this STD? Many people don't show symptoms of Mycoplasma genitalium, but when they do, they might experience painful urination, discharge from the genitals, and pain or discomfort in the genital area. In women, it can cause pelvic inflammatory disease or PID, or as we call inflammation of the cervix, while in men it can lead to non-specific uteritis or NSU or inflammation of the utera. So you can treat this while taking antibiotics like azithromycin or moxifloxacin are typically used to treat this infection. But drug resistance is a growing issue, making it harder to treat in some cases. Aside from treatment, you can also prevent it by using condom if you're having sexual contact, and getting tests can help prevent the spread of Mycoplasma genitalium. If you're diagnosed, it's important that your sexual partner also get tested and treated. While less known, Mycoplasma genitalium is on the rise, and awareness of its symptoms and the importance of regular testing can help in managing and treating this infection before complications arise.
Bacterial vaginosis or BV is a condition that happens when there is too much of certain bacteria in the vagina, causing an imbalance. Naturally, the vagina has an environment containing both good and bad bacteria. In bacterial vaginosis, the normal healthy bacteria are replaced by an excess of bad bacteria. This upsets and throws the vagina environment out of balance. Bacterial vaginosis is a common condition of the vagina. It is harmless and easily treated. The condition can affect women of any age, but women in their reproductive years are most likely affected. Most of the time, the condition doesn't cause any health problems. Sometimes, having bacterial vaginosis can lead to issue while trying to get pregnant, increase the risk of early delivery among pregnant women, resulting in pelvic inflammatory disease, and make women prone to sexually transmitted infection such as HIV, gonorrhea, and herpes simplex virus. It has been shown that HIV-infected women with bacterial vaginosis are more likely to transmit HIV to their sexual partners than those without bacterial vaginosis. The symptoms of people with bacterial vaginosis are burning during urination, vaginal itching, thin white, gray or green vaginal discharge, and fishy smell that gets stronger after sex. Occasionally, many people with bacterial vaginosis have no symptoms. Some risk factors of bacterial vaginosis. First is lack of lactobacilli bacteria. Bacterial vaginosis happens when the vagina's natural bacteria levels are out of balance. The bacteria in the vagina are called the vaginal flora. Balanced vaginal flora help keep the vagina healthy. Usually, good bacteria outnumber bad bacteria. The good bacteria are called lactobacilli and the bad bacteria are anaerobes. When there are too many anaerobes or bad bacteria, they upset the balance of the flora, causing bacterial vaginosis. Second is douching. The vagina is self-cleaning, so rinsing your vagina with scented soaps isn't needed. It may even cause problems. Douching upsets the vagina's healthy balance of bacteria. It can lead to an overgrowth of anaerobic bacteria, causing bacterial vaginosis. And lastly is having different sex partners or a new sex partner. The link between having sex and bacterial vaginosis isn't clear, but BV happens more often when someone has different or new sex partners. Also, BV is more common when the sex of both partners is female. So there are ways that can be done to prevent having bacterial vaginosis. First is, don't use scented products. Wash your genitals with warm water only. Scented soaps and other scented products may inflame your vaginal tissue. Use unscented tampons or pads only. Second is, don't douche. Douching won't clear up a vaginal infection. It may even make it worse. Your vagina doesn't require cleansing other than normal bathing. Douching disrupts the vaginal flora, raising your risk of infection. And lastly is practice safe sex. To lower the risk of STIs, use latex condoms or dental dams. Clean any sex toys. Limit your number of sex partners or don't have sex. Treatment options include antibiotics, which can either be given orally or applied directly inside the vagina. They include metronidazole such as Flagyl, Metrogel vaginal which can be taken orally and is also available as a topical gel, clindamycin such as Cleocin which is available as a cream, and tinidazole which is taken orally. Bacterial vaginosis is not a sexually transmitted infection, and it is generally unnecessary to treat a male sexual partner of an infected woman. Female partners should seek testing as they may need treatment. Pregnant women with symptoms should be treated to help decrease the risk of premature delivery.
Hi guys, I'm Justin Jane CABILINGA, and I will discuss about HIV and HSV. But first, we need to talk about HIV or Human Immunodeficiency Virus. So what is HIV? So HIV is a virus that attacks the body immune system. It targets the white blood cells, weakening the immune system. So this kind of virus, this is much worse than we thought. because HIV targets our immune system, which is our source for protecting against diseases and illness. So if we didn't know that we have HIV, we're gonna be doomed for this. Not just ourselves, but also our body. The causes of HIV has many causes, but I presented only two because these are the primary causes. The first one is through sexual intercourse, whether it's vaginal or anal sex, without using protection with someone who has HIV. So this also primary causes because it occurs or it happens when you have a sexual intercourse with her or him. And also through needle sharing or other equipment used to inject drugs with someone who has HIV. So it's just like a COVID-19 symptoms rather, but in a different definition or matter. The symptoms of HIV vary depending on the stage of infection. The disease spreads more easily in the first few months after a person is infected, but many are aware of their status under the later stages. In the first few weeks after being infected, people may not experience symptoms. So it's just like a COVID-19. For example, they thought that it was an ordinary cough, but a few weeks later, when the doctor checked it, it was a coronavirus. So just like they're very similar but different definition or matter. HIV can also have influenza-like illness, including fever, headache, rash, and sore throat. So HIV can also have an influenza-like illness. So the infection progressively weakens the immune system. The signs and symptoms are the following: the swollen lymph nodes, the weight loss, fever, diarrhea, and also coughing. If a person can treat this virus to the doctor, they can develop the severe illnesses like TB or tuberculosis, cryptococcal meningitis, severe bacterial infections, cancers such as lymphomas and Kaposi sarcoma. HIV can also get other infections worse, such as Hepatitis B and C and the Mpox, which is now a World Health concern, the so-called Mpox. The treatment for HIV is the antiretroviral drugs, which stop the virus from replicating in the body. The HIV has no cure as of now, but the scientists to find the cure of this kind of virus. To reduce the risk of HIV infection, follow these things. Number 1, use protection during sex. Second, being tested for HIV and STIs or sexually transmitted infections. Number 3, having a voluntary medical male circumcision or sa Tagalog pa to, pagtuli. I know it's kinda very painful but it is good for your health. Not just in your reproductive system, but also in your body. Lastly, using harm reduction services for people who inject and use drugs. So, doctors also suggest medicines and medical devices to help prevent the HIV, including these following things. Number 1, the ARVs or antiretroviral drugs. ARVs are also used to prevent mothers from passing HIV to their children or inherit HIV to their children. Next is the dapivirine vaginal rings and injectable long-acting cabotegravir. ARVs are including oral PrEP and long-acting products. People taking antiretroviral therapy or ART or ART and who have no evidence of virus in the blood will not pass HIV to their sexual partners. So which means you and your partner is safe. Access to testing and ART or antiretroviral therapy is an important part of preventing HIV. If you can't access to this so-called antiretroviral therapy, then you are whether you have that virus or you're safe. So that's it for the HIV. So my next report will be the HSV. So next topic. Hi guys, my name is Justin J. CABILINGA, and I will discuss about the herpes simplex virus, or also known as HSV. So what is herpes simplex virus or HSV? So it is a common infection that can cause painful blisters or ulcers. It primarily spreads by skin-to-skin contact. It is treatable, but at the same time, it is not curable. Well, I guess it's a loss trade for you. HSV has two types, the HSV1 and the HSV2, also known as type 1 and type 2 respectively. So HSV1 mostly spreads by oral contact and causes infections in or around the mouth, or also known as oral herpes or cold sores. It can also cause genital herpes. The most carriers of it were adults. Meanwhile, HSV2 spreads by sexual intercourse. Most people has no symptoms in it or only mild symptoms. Infection can cause painful blisters or ulcers that can recur over time. Medicines can reduce it, but it cannot cure the infection, which is way worse than HSV1, because HSV2 is, it can treat the symptoms, but it can cure the infection. That's not good. The causes of HSV are the following: painful, recurring blisters or ulcers, which is mentioned. New infection may cause fever, body aches, and swollen lymph nodes. Yeesh. So, the symptoms though may be different during the first episode, or also known as the outbreak of the infection, than during the recurrent episode. If the symptoms occur, they often begin with some sort of tingling, itching, and burning near where the sores will appear. Common oral herpes symptoms including some blisters, or also known as cold sores, or open sores, or also known as ulcers, in or around the mouth or lips. Common genital herpes symptoms include the bumps, the blisters, or open sores, or also known as ulcers, around the genitals or the anus. The sores, or these sores, and blisters are typically painful. Blisters may break open, ooze, and then cross over. The treatment are some antiviral medicines commonly given include the acyclovir, famciclovir, and valacyclovir. If you know this type of antiviral medicine, well, congrats. Anyways, back to the discussion. So to prevent this HSV, you need to follow the following things that must avoid or to do. Number 1, avoid sun exposure, and wearing the sunscreen can lower the risk of recurrences. Make sure the rice is in here, okay? Let's pretend that you didn't see it. Anyways, back to the discussion. So to decrease the symptoms of oral herpes, people can drink cold drinks or suck on popsicles. Not that kind of popsicles that pops out in your head, okay? Next is use over-the-counter pain medicines. For genital herpes, people can sit in a warm bath for 20 minutes without soap, wear loose-fitting clothes, and also use over-the-counter pain medicine. And also, there are ways to lower the risk of spreading herpes, including talk to your partner about having HSV, don't have sex if you have symptoms, and always wear a protection. And lastly, don't share items that touch saliva or known as the oral herpes. If you didn't follow these instructions, you get HSV and much worser, forever having an HSV. Got it? So that concludes our discussion with the HSV or the herpes simplex virus. So I'll pass it to the next reporter. Thank you.
HPV or human papillomavirus. HPV is a viral infection that commonly causes skin or mucous membrane growths, also known as warts. There are more than 100 varieties of HPVs. The common types of HPVs infection causes warts and some even causes cancers. In the year 2019, HPV caused around 622,000 cancer cases in women and 700,000 in men. So there are two types of HPVs, the low-risk HPV and the high-risk HPV. The low-risk HPV causes warts in the genitals or in any other parts of the body, but it did not usually lead to cancer. However, the high-risk HPV is the type of HPV that causes cancer, such as anal, cervical, throat, and penile. How is HPV transmitted? HPV can usually be transmitted through sexual contact and skin contact. If a person is positive in HPV and have sexual intercourse to other persons, the risk of HPV being transmitted is high. HPV can also be transmitted to cuts or wounds in the body, sweat, and other skin contacts. What are the symptoms of HPV? In most cases, HPV can be defeated by the body's immune system before it even creates warts. If warts do appear, they vary in appearance depending on which kind of HPV is involved: genital, common, or plantar warts. Others also even have warts appearing on their throat, but there is a very small chance of this happening, so this happening is very rare. Cancerous HPVs usually takes about 15 to 20 years before it shows symptoms. The complications of HPV can cause oral and upper respiratory lesions. Some HPV infections can cause lesions on the tongue, tonsils, soft palate, or within the larynx or the nose. How to tell if you have HPV? You can do the pap smear test that checks your cervix for any risk of HPVs. Along with the pap smear test, you can also do a blood test for HPV. And here's how to prevent HPV. Being vaccinated is the best way to prevent HPV infection. Also, if people do engage in premarital sex, using condoms can reduce the transmission of HPV, but be reminded that it does not eliminate the risk at all. Treatments for HPVs. Warts can be surgically removed. Methods such as cryotherapy and topical medications can also remove wart. For cancers, treatment caused by HPV are more effective if diagnosed early. Treatment should begin immediately after diagnosis. Hepatitis B. Hepatitis B is a viral infection caused by the Hepatitis B virus, or also known as HBV, that affects the liver, leading to acute or chronic liver diseases. The World Health Organization estimates that 254 million people were living with chronic hepatitis B infection in the year 2022, with 1.2 million new infections every year. So how is the hepatitis B virus transmitted? The virus is most commonly transmitted through mother and child during pregnancy and delivery, during early childhood, and as well as through sexual intercourse, blood contact, and other skin contacts such as sharing of used injection needles. The virus can survive 7 days inside the body. This can cause infection to the persons not having vaccines. It takes about 30 to 180 days after infection before the virus shows symptoms. And here are the symptoms of the hepatitis B infection. Most people don't experience symptoms when newly infected. Some have acute illness and symptoms that last several weeks, such as yellowing of skin and eyes, dark urine, feeling very tired and very weak, nausea, vomiting, and pain in the abdomen. When the infection is severe, the acute hepatitis B infection can lead to liver failure, which can eventually lead to death. How to tell if you have hepatitis B infection? Blood test is the most efficient way to tell if an individual has hepatitis B infection, and also to determine if the infection is acute or chronic. Here are ways to prevent hepatitis B infection. To reduce the risk of getting hepatitis B infection, a person must practice the following. Practice safe sex by using condoms and reducing the numbers of sex partners. Avoid sharing injection needles or any equipment used for injecting, piercing, or tattooing. Always wash hands properly and immediately when handling with blood, body fluids such as sweat, or anything contaminated. And more importantly, a person must get a hepatitis vaccine. To newborns, it's best to give the baby the vaccine as soon as possible within birth. The vaccine can protect the individual for 20 years and probably for life. How to treat hepatitis B infection? There is no specific treatment for acute hepatitis B. Acute hepatitis B mostly go away on its own. But for chronic hepatitis B, it may require antiviral medications to reduce liver damage and to prevent complications like cirrhosis or liver cancers. It is best to be monitored regularly by a healthcare provider.
Panagdive everyone, I am NATHANIEL BUCOL and today I would like to discuss about the Molluscum, Contagiosum, and the Trichomoniasis. So first, what is Molluscum contagiosum? So Molluscum contagiosum is a viral skin infection mostly affecting children under 10 years old. It appears as localized clusters of small raised umbilicated bumps on the skin. So this condition is more common in those with atopic dermatitis or poor immune system, just like children. So this disease thrives in warm, overcrowded environments. So what are the causes of this infection? So accordingly, Molluscum contagiosum is caused by pox virus with 4 known subtypes. So this virus spread through direct skin-to-skin contact, sharing contaminated items such as towels, scratching or shaving over the bumps, sexual transmission in adults. So transmission is more likely also in wet environments like swimming pools. So what could be the possible signs and symptoms? So accordingly, small raised round skin-colored bumps less than 6 mm in size with a dent in the center. Bumps often appear on the face, trunk, arms, or legs in the children and the genital area in sexually transmitted cases in adults. And these bumps can be itchy and pink. So, what are the treatment? So, Accordingly, there is no cure exists to kill the virus, but there are several treatments available. So we have the physical treatments and medical treatments. Under the physical treatments, we have the laser ablation, and medical treatments, we have the salicylic acid, hydrogen peroxide creams. So a new treatment also, such as berdazimer gel, is under FDA review. So aside from treatment, we have also prevention. How to prevent this kind of virus? So preventive measures include frequent hand washing or proper hygiene, avoiding contact with bumps, not sharing personal items such as I said earlier, the sharing with towels, and also covering the bumps, and sexual contact, of course, should be avoided if the infection is present near the genitals area of your partners or you too. So next we have the trichomoniasis. So accordingly, trichomoniasis is a commonly sexually transmitted disease caused by the parasite Trichomonas vaginalis. So it primarily affects particularly women. So according to the study, many people with this disease show no symptoms. So what are the causes? So this disease spreads through sexual contact, primarily between the penis and vagina or between two vaginas. It can infect areas like the vulva, the vagina, cervix, urethra, and in men, the prostate. Rarely, it affects other parts of the body like the hands or mouth. So, what are the symptoms? So, in women, foul-smelling green or yellow vaginal discharge, itching, burning redness or soreness in the genital area, pain during urination or sex, frequent urination, and bleeding after sex. So in men, so itching or irritation inside the penis, thin white discharge, then just like women, pain during urination or sex, and frequent urination. So accordingly, as what I have said earlier, that around 70% of people with this disease show no symptoms. So what could be the possible treatment if someone has this kind of disease? So accordingly, it can be treated with antibiotics, typically the metronidazole or tinidazole. So these medications are effective for most people and come in either single or multiple doses. So if this patient taking these antibiotics, he or she must avoid alcohol, for it have the potential of side effects like rapid heart rate. So how to prevent this one? So of course, when having sex, use condom to prevent contact. Avoid douching as it for women, as it disrupts the vagina's natural bacterial balance. Limit also the sexual partners or having a monogamous partner who has tested negative for STDs. And last, communicate openly with sexual partners about STD risk and histories. And I think that's it.
I am going to discuss to you all about the pubic lice and scabies. Learning outcomes of this discussion: by the end of this lesson, learners will be able to understand how pubic lice and scabies are transmitted and recognize their symptoms, as well as identify the appropriate treatments and preventive measures. Now let's talk about pubic lice. Pubic lice are tiny insects that live on your pubic hair. Pubic lice are also called crabs. Lice are a type of parasite because they feed off of human blood to survive. Pubic lice that live on your coarse body hair, including pubic hair, armpit hair, beards, chest hair, eyelashes, eyebrows. So, how might I catch pubic lice? The answer is, pubic lice are most commonly spread through skin-to-skin sexual contact. You can also catch pubic lice by having close, non-sexual contact with someone who has lice. Example, kissing someone with an infested beard or mustache, sleeping in the same bed, or sharing towels or clothing. Pubic lice only infect humans, so you can't catch them from pets or other animals. So for the symptoms and causes, questions like this may occur. Can I get pubic lice from a pet? The answer is no. Dogs and cats and other pets don't spread pubic lice. And other questions like this, are pubic lice the same as head lice? No. The lice you get on your head and body are a different type of lice than pubic lice. Pubic lice don't usually attach themselves to the hair on your head. And question like this may occur also. Can children get pubic lice? The answer is yes. Children might get pubic lice if they sleep in the same bed or use the same towels as someone who has pubic lice. It's more likely to infest their eyelashes or eyebrows. Pubic lice in children may be a sign of sexual abuse. So, for the prevention of pubic lice, you may be asking now, how can I prevent genital crabs? So, the only way to prevent pubic lice is to avoid any close physical contact with people who have it. Still, you can take reasonable steps to lower your risk for crabs and prevent them from coming back. So listen, I will give you the do's so that you can prevent pubic lice. So, avoid sharing personal items like clothes or towels. Limit your sex partners and try to avoid sex with people who have multiple sex partners. And make sure your partners get treated if you had pubic lice. And then the last one, wash clothing, bedding, and towels in hot water. And please do check regularly. Treatment involves non-medical and medical strategies. The non-medical strategies involves cleaning your pubic region very well and using creams and lotions to soothe the itching and inflammation. You don't need to shave your pubic hair if you don't want to. Then there are 3 medications you can use. They are all creams and your doctor can give you the proper instruction to know how to use them. They are named permethrin, melathion, lendane. Lendane cannot be used in some instances, such as if you're pregnant. So make sure to discuss your medical history with your doctor before using it. You probably be wondering, what do pubic lice look like? Pubic lice are very small. You may be able to see crabs by looking closely at your pubic hair. Adult pubic lice resemble crabs you'd see near the ocean. That's how they get their name, crabs. The lice look different depending on their stage of growth. Nits, these lice eggs are hard to see. They are usually oval and yellow, white or pearly. Nits attach to the root of your hair, where your hair comes out of your skin. Pubic lice nits take about 6 to 10 days to hatch. Nits is the egg. Tinatawag natin itong ano bang tawag nun? Lusa. Itong egg, para din itong lusa na nasa buhok natin sa ulo. And the other one is called nymph. This is the young loose singular of lice. that hatches from the egg. Each one needs about 2 to 3 weeks to become a mature adult. Ito namang nymph ay para din itong kuyamad kung tatawagin natin. At itong adult, a fully grown luce has 6 legs. The front legs are larger and resemble a crab's pincer claws. Adult are tan or grayish white. They are about 1.1 to 1.6 millimeters long, about the size of the tip of a pencil. Nymphs and adult lice feed off of human blood to survive. They die within 72 hours once it falls off a person. Today's topic is about scabies. Scabies is a transmissible skin disease characterized by relentless itching and an angry rash. Scabies is not an infection, but an infestation. Tiny mites called Sarcoptes scabii set up shop in the outer layers of human skin. The skin does not take kindly to the invasion. As the mites burrow and lay eggs inside the skin, the infestation leads to relentless itching and an angry rash. The itching and rash associated with scabies are as a result of the body's allergic reaction to the mites, their wastes, and their eggs. It is highly contagious and can spread very easily from person to person. The mode of transmission is through a close skin contact with an infected person, such as sexual contact among sexually active people, or through hugging. Scabies can also be spread by sharing clothing, beddings, and furniture infested with mites. Scabies commonly occurs in people in crowded living conditions, such as those found in prisons, child care groups, family homes, and hospitals or nursing homes. Scabies is estimated to affect over 300 million people each year throughout the world. It can affect people in all ages, race, and gender. Often between 10 to 15 mites are involved in an infection. Scabies has nothing to do with poor hygiene, and therefore anyone can be affected. A more severe case is the crusted scabies that typically occurs in people with weakened immune system. In adults and older children, the infestation site may include armpits, knees, buttocks, around fingernails, and in between the fingers or soles of the feet. In infants and young children, the site of infestation may include another part of the body like the scalp, neck, face, and palms of the hand. Causes: scabies is a dermatologic condition caused by infestation by the female mite Sarcoptes scabii. The mites burrow into the skin to live and deposit eggs in the burrow tracts it has created. Once hatched, the larvae move to the skin surface and spread across the body. They take about 25 to 60 minutes to burrow into the skin. The female mites of about 0.3 millimeters to 0.4 millimeters long are the ones that infest humans. Sign and symptoms: itching is one of the most common symptoms of scabies. It often gets worse at night and can be severe and intense. Rash composed of small red bumps and blisters. Sores: loss of sleep due to intensely itching skin. Diagnosis. Diagnosis of scabies is based on the sign and symptoms. The doctor can diagnose scabies by examining the skin or by carrying out a skin scraping test. The skin is scraped sideways with a scalpel blade over an area of an embargo, and microscopic examination is undergone. This makes it possible to identify mites or eggs. In situations where the diagnosis is difficult, polymerase chain reaction testing is available. Treatment. Scabies is highly contagious, so anyone with whom a patient has had recent close contact with will most likely be asked to receive treatment even if they do not have symptoms yet. There are several medications available to treat infected people. Scabicides such as ivermectin pills, crotamycin cream, permethrin cream, or lindane lotion can administer. Antihistamines, anti-itching lotions, and antibiotics can be useful in providing relief from itching. Linens and bedclothes are to be washed in hot water and dried in a hot dryer. So, here's a note from Cleveland Clinic. Hear this, people. If you have a rash and it is so itchy and you can't sleep, make sure you contact your healthcare provider. You may have scabies, which is an infectious disease caused by tiny mites. You and other people close to you should receive treatment right away for scabies. You'll want to contact your healthcare provider if you have any kind of skin rash that doesn't go away and that causes problems for you. Scabies, like many other types of red and itchy rashes, is treatable with medications.
So let's talk about fungal STDs. So under fungal STDs is Candidiasis or yeast infection. So it is a fungal infection that most often affects women but can also occur in men. So what caused this yeast infection? So yeast infection are caused by an overgrowth of the fungus Candida. So what is Candida first? So Candida is a yeast, a type of fungus that is typically found in small amounts on your mouth, skin, and in your intestine. So Candidiasis, which is normally present in small amount in the vagina, so that's why it most often affects women. So the factors that can trigger an overgrowth include taking antibiotics, high sugar intake, hormonal changes, or a weakened immune system. So what are the symptoms of it? So the symptoms of a yeast infection includes intense itching, burning, redness, swelling, and thick white discharge. Some women also experience discomfort or pain during sex or while urinating. In this case, we also have treatments. So, yeast infection are treated with antifungal medications, which can be taken orally or applied, typically as cream or suppositories. These medications are usually effective and symptoms typically improve within a weeks or a day or a few days. We have preventions also. So, to prevent candidiasis, we need good hygiene, wearing loose-fitting cotton underwear, avoiding douching. Douching is like washing the inside of a vagina, and and reducing sugar intake can help prevent yeast infection. So, while yeast infections are common and easy treated, practicing good hygiene and maintaining a healthy lifestyle can help prevent recurrence